June is Men's Health Month, so we thought it would be a good idea to review some of the ways to help the men in your life avoid sickness. Dr. Stacy Chronister is an internal medicine specialist with OSU Medicine, and I have to ask you, when a guy comes into your office, did they do it voluntarily?
Not typically. Usually they say, my wife made me an appointment with you.
What is it about that?
You know, and I think that it's just men are so used to taking care of a lot of things, and health gets put on the back burner, and also it can be a little bit scary, right? What if somebody tells me to change my lifestyle? What if somebody, tells me something's not right with me? And I can understand that's really scary. So hopefully everyone can find a provider that works for them. It makes them feel a lot more comfortable to talk about health issues.
I think that's what's really important, is when you find a doctor that you can connect with and have conversations, it can prolong your life.
Absolutely. And what we're going to talk about today is mostly preventative.
Okay, so let's first of all talk about some of the guidelines, because I know they change from time to time, but more importantly, they're very different from women. So let's take a look at here. When we're looking at screenings, blood pressure, how often should a man have his blood pressure checked?
Absolutely every 2 years, ideally every year. But if you have a family history of having high blood pressure, I want you coming in sooner, starting in your 30s, on a yearly basis.
All right, now talk about hepatitis C. This is a blood draw. That might scare some people.
Yes, but we're doing blood draws maybe once a year, every 2 or 3 years. Anyway, this is easy. It can be added right on. But any adult over the age of 18 to 75 should have a hepatitis C antibody drawn at least one time in their life.
What are they looking for on
They're
that?
looking to see if you have a hepatitis C virus, which you may be completely unaware of, because it can be stagnant for decades until it reactivates.
Interesting.
Yes.
Cholesterol. We hear about a lot of guys, well, women too, but cholesterol levels can be dangerous.
Yes, you have to think about that man who has a heart attack, and unfortunately it is that 50 to 55, 60-year-old male who has high cholesterol, maybe history of smoking, not eating well, not exercising. So this is part of that picture, and we want to prevent that as much as we can.
What is the number now for most people?
Yeah, so we want that overall cholesterol, that bad cholesterol, less than 150, absolutely. But as high as we can get your good cholesterol, that HDL, and that comes with exercise and good sleep.
Diabetes, another problem that we see a lot of Oklahomans are prone to.
Start screening that about age 45 is when we start looking at that. But cholesterol, we start screening at age 35.
We also hear about colonoscopies and colon checks.
We've always thought about that at age 50, but it's really shifted now to age 45. We're seeing that if we can start that earlier at age 45, we can really get a lot more people screened and treated. It is so easy to treat if you can catch it early. And there's a lot of different ways to do it. So we can test stool, or you can go for the full colonoscopy, and it'll give you 1, 3, 5, maybe even 10 years before you have to be screened again.
Right, and I think that's the important thing, that men need to realize, that while some of these tests seem invasive or dangerous, the earlier you find a early problem, the better it is long term.
Absolutely, and you avoid a lot of the harm and a lot of the chemotherapy and a lot of the frightening things where you just say, oh, they found a little nodule and they got rid of it, and now
way before it got to be bad.
Yes.
Exactly. Also, okay, let's talk a little bit about prostate screenings, because that is another area
every man, I think, avoids going to the doctor at age 50 because they think, oh no, this is when I have to get my prostate screened. But we're really not doing that any longer. We kind of found that we were putting people through a lot of torture without really saving their lives. So right now we are not doing prostate screenings unless you are high risk. So if you have a family history of it, particularly in a first-degree relative, so a brother and a grandfather, a father, then we will talk about if you even need to be screened.
Now, do they still check the PSA levels?
And not necessarily.
No.
And again, I think that really falls into does this person need it or not?
Okay, very good. Testosterone. I can't turn on the TV without hearing an ad about this.
I know.
And I think it's one of those things where men just naturally think, well, I need to have this restored. It's my levels are low, but there's some natural things that people can do.
Absolutely, and we have to recognize that it's normal for testosterone levels to drop. But if we can naturally bring them up, one, get 8 hours of sleep at night. Make sure you aren't snoring. If you have a partner who tells you snore, absolutely get a sleep study, because we can lengthen your life. And if you're not getting good sleep, that is when your testosterone levels boost, is in the middle of the night. So you getting poor sleep is actually declining them. Exercise, drinking plenty of water throughout the day, and decrease the amount of alcohol you're using, eliminate tobacco, and decrease marijuana use, because those are all things that decrease your natural testosterone levels.
So a woman's watching this, married, has a brother, has a dad, whatever, what do you tell them?
And you say, hey, you're snoring. I heard that this will increase your testosterone levels if we can get that under control. And I promise you that is one of the things that I think men worry about, their testosterone levels, and knowing that we can make their lives healthier by stopping their snoring, but we can also make them feel better, I think is a big driver.
Excellent. Well, we always appreciate you. Enjoy the month of June, and we will see you next time here.
Absolutely.
Appreciate it.